Shin splints are a common complaint in individuals involved in running and jumping. However, there is still a lot of confusion surrounding shin splints, its contributing factors and treatment. Hello, my name is Shiv and today we will be talking all about shin splints. Shin splints, medically known as tibial stress syndrome, is an overuse injury often seen in individuals involved in moderate to high intensity of physical activity. In this condition, periosteum, which is the covering of the bone, and tissues attaching to it gets inflamed and painful. In worst case scenario, it may lead to stress fractures. One theory suggests is the bone's reaction to stress, and another theory suggests is the traction from the tight muscles attaching to the covering of the bone. Two locations where shin splints or the tibial stress syndrome can occur. First is the front of the shin bone, which is called as anterior tibial stress syndrome, and second is the inner border of the shin bone, which is called as medial tibial stress syndrome. The common contributing factors which may lead to shin splints are sudden increase in intensity of training, poor recovery, rest, running up and down the hill, biomechanical factors such as stiff ankle joint, poor running technique, weak and tight calf muscles. So now let's have a look at the exercises which you may do for anterior tibial stress syndrome. First, we need to rest and ice the inflamed area, which will help in reducing the inflammation and pain. Next is to massage the muscles in front of the shin bone. Either you may use your hand to massage them or use a foam roller. Next is tibialis anterior stretch. Either you may just sit in a kneeling position, feet flat on the ground. There should be no pain over the injured area while doing this stretch. If you feel pain, wait for a few days or weeks for the symptoms to subside. Duration may vary depending on the severity of symptoms. You may also stretch this muscle in standing position. Keep one foot back with the top of the toes touching the ground and bend the knee. You will feel a mild stretch in front of the shin. Next are the two calf stretches. For the first one, keep the back knee straight, and for the second one, keep the back knee bent. After a couple of weeks, when the symptoms have subsided, you may start strengthening. Stand with the back against a wall and feet slightly away. Lift the toes up and down. Gradually, you may increase the number of repetitions. Next is heel walk. Lift your toes up and walk. This is more static contraction of the muscle. Initially, you may do this for 20-30 seconds and gradually increase to 1 to 2 minutes. Next is calf raises. Stand with your feet hip width apart and tiptoe. Keep the knee straight during the exercise. Gradually, you progress by doing the same on one leg. So these were the exercises for anterior tibial stress syndrome. In the next video, we will go through the exercises for medial tibial stress syndrome. I hope you liked the video. If you have any questions, please ask in the comment section below. And please don't forget to like and subscribe to the channel. Stay fit, keep going, love life.